The head of Anaesthesia services in Kigezi Region and medical training lead at Kabale University, Dr. Isabella Epiu, has said the medical faculty has spearheaded the program for the past 3 years, with annual reviews held every 31st January.
Increasing access to safe anesthesia here in southwestern Uganda. Well aware that globally, 5 billion people worldwide lack access to safe surgery, and a lot of this could be improved by increasing access to anesthesia. While we have several surgeons across the country, even in Kigezi, even in Kabale where we are still short-staffed in terms of anesthesia.
She explained that regional anesthesia improves patient safety and recovery outcomes, but noted that more health workers still need to be trained.
Increase access to anesthesia. Recently, we've had a new equipment being purchased for our hospitals. We request for training for the users of this equipment, and also to ensure that the drugs like sevoflurane, isoflurane that are used by these anesthetic officers on the new machines will be provided.
She further noted that limited resources continue to affect the expansion of the program across hospitals in the region.
Anesthesia needs to change, the airway needs to be protected, the anesthetist needs to proceed to what she well knows what to do, but possibly does not have the right equipment. We need to ensure that each of these centers that handles mothers, that handles deliveries, that has been put to a level of having a theater, has all the equipment that we need to deliver. Small things like laryngoscopes, the drugs, not to only buy local anesthetic drugs, but also to ensure things like saxamethonium are available.
Benny Kamagaju, principal anesthetist, emphasized the need for increased support from the Ministry of Health to equip hospitals and train more personnel.
So during our training, the participants were able to pick everything. They are happy. We've given them skills on life support. We've given them skills on safety in anesthesia, where we looked at the surgical safety checklist. We looked at unanticipated difficult airway. We looked at life support, basic and advanced life support.
He added that increased government funding is required to enable all hospitals in Kigezi Region to adapt regional anesthesia services.
One incident was tranexamic acid toxicity. The other incidents, 2 incidents were PPH on table, but we tried to figure out how we can reach them. However, the challenge we have is funding. At times they call you, if you look here, look there, there's no transport, there's no what. If the funds would be increased more, then we would be able to serve you more and better.
Other health workers described the method as safer and more effective than general anesthesia.
We looked at different things that are basically crucial for the patients, like resuscitation. We looked at that. So